Hello, my name is Anne-Marie Odo. I'm a nurse practitioner student at Brandman University. I will be performing a physical exam on Chichi, who has volunteered for this procedure. Please, at any time, if you feel any pain or discomfort, let me know. Okay? I have observed Chichi ambulating with steady gait, no apparent distress noted. Vital signs was taken and it was within normal limits. Snelling test was performed and the visual acuity was 20/20. Cranial nerve 1 olfactory has been checked, no difficulty smelling noted. I have pulled the curtains and the door for privacy and washed my hands, and now I will start assessing the skin, hair, nails, head, face, ears, nose, and sinuses. Also the neck and the lymph nodes. First of all, I'm looking at his skin. Skin is appropriate for ethnicity. No lumps, lesions, no rashes noted, no cyanosis, no clubbing. Checking for clubbing, cyanosis, cap refills in less than 2 seconds. And hair, he has even distribution of hair all over his body. So skin is clean, dry, and intact. So I'll move and start doing his skull. Do you have any lesions, pain, tenderness, or did you have any fall recently?
No, ma'am.
Okay. So I'm going to touch your head to check if you have any tenderness to your skull. Any pain?
No.
Okay. So now I'm going to look at your ears to see your pinna looks clean and is symmetric with your face. So I'm going to check your sinuses to see if you have any swelling. Tell me if you feel pain. I'm going to check the frontal, the ethmoid, and the maxillary sinus. And then I'm going to check your lymph nodes. Check your back lymph nodes. And then I will check you here. And check your axillary lymph nodes. So with that being done, do you feel any tenderness or any pain?
No.
Okay, I'm going to use my otoscope. I'll shine some light in your eye to check, okay? So I'll be checking for your cranial nerves number 2, number 3, number 4, and number 6. I don't think this one. Okay, so let me see. You have positive red eye reflex. Okay, so and your pupil was retracted from 4 cm to 2 cm with the light on it. So everything looks within normal limits. So I want you to follow my hands and tell me, this is to check for your extraocular movement. So follow my hand with your eyes and not your head. So look up. Checking for convergence. Okay, now I'm going to tell me when you see my hand, okay? Close your eyes with one hand and tell me when you see my hand.
No. No. No.
Okay, change your hand.
No. No. No.
Okay, that's good. You can bring your hand down. So pupil is round, reactive to light and accommodation. So Perla was noted to eyes. So now I'm going to do your face, and I'm checking for cranial nerve 7. Smile, please. Okay, so frown your face, puff out your cheek. I'm checking for symmetry. No abnormalities noted. So I'll be checking your mouth for cranial nerve 5, 10, 11, and 12. So me see. Your mouth appears symmetry, okay? Okay. So your uvula is midline. You have good dentition, and I think that's it. Okay, let me check for your gag reflex. Okay, you have good gag reflex. So now clench your teeth. Close your mouth, push your chin down. Okay, so bring out your tongue, push left, right, up, and down. Okay, push against my hand, here. Okay, so your face looks symmetry and everything in your mouth and your tongue looks okay. No abnormality was noted. So now I'm going to look at your neck. Your neck looks symmetry. I didn't see any striae, any rashes, any lesions. So I'm going to check. Okay, let me look on the side. This side. So I'm going to palpate for your carotids. Okay. So push against my arm here. Push here. Muscle strength is good, so turn left, right, back, and front. Okay, so push and push. Resist my hand. Okay, push up on my hand. Okay, so I'm going to check for your thyroid now. I have to go to your back. Let's see. Turn to the left, right, bring down your head and try to swallow. Okay. I could palpate the thyroid, and there was no tenderness or pain noted. Did you feel any pain?
No.
Okay. So from the thyroid, so I'm going to check your do a Weber and a Rhine test on you. So I want to see, want to know if you can hear bilaterally this sound. Tell me when you stop hearing it.
No.
Okay. So I'm going to put this on your mastoid.
No.
You still hearing it?
No. No.
Okay. So your ear conduction is longer than your bone conduction. So I'm going to check it if you do feel it in your wrist.
Yes.
Okay.
Yes.
Okay.
Yes. Yes.
Okay. So after that, I'm going to your lungs. I mean your chest and lungs. I'm inspecting your thorax for symmetry posteriorly and anteriorly. So I'm looking at your chest diameter for symmetry. Normal inspiration is noted and expiration. I didn't see that you use your accessory muscles to breathe. So I will check your respiratory excursion. Going to So I have checked, I've excused you, and I see that you have resonance on your back, and there's no problem. So I'm going to hold and do your tactile parameters. So I'm going to listen for vibration. When I touch you, you say 99.
99. 99. 99. 99. 99. 99. 99.
Okay, so I can feel vibration every time you said 99, so your tactile parameters is intact. So I'm going to ask you to take a deep breath and check for that. Deep breath. Okay, good. So I will check for CBA tenderness, like around your liver. Tell me if you feel pain.
No. No.
Okay. So after that, I'm going to listen to your lung sounds at the back. Okay. Take a deep breath. Exhale. Deep breath. Exhale. Deep breath. Exhale. Deep breath. So I'm going to do the same thing for the front. Deep breath. Okay, so your breath sounds are clear and equal bilaterally. I will use the pin side, I will use the bell sides to listen for louder sound, but I'll do the same thing just like I did earlier, but for the sake of time, I will not do this. So right now, I will move over for the cardiovascular check. So I will check your peripheral pulses, like radial pulses, pulses posterior tibialis, and then dorsalis beads, right here. This is right here. So all your pulses are strong and palpable. So I will auscultate for carotid bruit. So I will use both the bell side and the diaphragm side. Okay, so there's no bruise noted to your carotid. So let me quickly measure it. I already put a pillow here, giving it like a 30-degree angle, so I can look at your JVP. So JVP is about 3 cm above sternal angle. Okay. Get up, teacher. So now I'm going to auscultate your heart sounds. I will go with the bell side, the diaphragm side first, and then I'll do the bell side. So I'm doing the aortic, pulmonic, Ebbs point, tricuspid, and mitral. Okay, so I'll change it to the bell side. Aortic, aortic, pulmonic, Ebbs point, tricuspid, and mitral. Okay, so the PMI is noted at mid-clavicular line at your 5th intercostal space. So your capillary refill is less than 3 seconds. I'm checking your cap refill down here too. Okay, so cap refill is less than 3 seconds. Next, I'm going to check your abdomen. Lie down. Okay, so first I'm inspecting your stomach for any scars, striae, hernias, lesion, rashes, which I don't see. So now I will start with auscultating your abdomen, and then I will palpate, percuse, and then I will do deep palpation. So first of all, let me palpate. I do not see any distension to your stomach or anything going on. It looks clean and it looks clear. I don't see any discharge or anything going on. So I will auscultate all 4 quadrants. 4. Okay. So I'll start with the left lower quadrant, right lower quadrant. Going to this one. Left upper quadrant and left lower quadrant. Next, I will auscultate the with the bell side. I will auscultate the renal artery, the aortic, the iliac, and the femoral artery. Okay. Now I will do a light palpation. So I'll start from here. Tell me if you feel any pain or tenderness. Light palpation. Do you feel tender there? Okay. So I will palpate for your liver and your kidneys and your spleen, your aorta. Okay. So take a deep breath. Take a deep breath. Deep breath. Okay. I'm not able to palpate the liver. Okay. So I'm going to palpate for the spleen now. Deep breath. Deep breath. Okay. So let me check for CV tenderness. Any tenderness?
No.
Any tenderness? No. Oh yes. Any tenderness? Any tenderness?
Oh no.
Okay. So I'm gonna check for Murphy's sign, and I've already checked for your liver and gallbladder abnormalities. I do not see any tenderness, so I'm going to check for Murphy's obturator sign, and then I'm gonna ask you to bend your knees and raise your hip. I'm gonna bend your knee inward and then outward. So do you feel any pain? Any pain?
No.
Okay, so that's negative for appendicitis. So I'm gonna do the same on this side. Any pain?
No.
Any pain?
No.
Okay, so. Well, I'm skipping the genital. I'm going to skip the genital assessment part of this, but if I were to do it, I will check for discharge. I'll check for rashes. I'll check for the testes. I'll check the penile. I'll check for pain or any tenderness, and I'll make sure that patient verbalizes that he doesn't feel any discomfort in that area. So next I'll go to the neurological. Can you sit up? Okay. Can you do finger to nose? Can you touch your nose with your fingers? Okay. So close your eyes. Close your eyes. What is this?
Key.
Okay. Close your eyes. What is this?
Coin of some sort. A penny.
Okay. Good. So let me okay. So open your eyes. So I'm gonna check. Can you do your heel to shin for me? Touch your end of your leg to your shin for me. No. From here to here. Put your this leg over here. Heel to shin. Yeah. Okay. So I'm going to do your what else now? Oh. Okay, so let me check for your sharp. Close your eyes. Close your eyes like that. I'm gonna check for sharp and dull. Okay, I'm gonna put 3 things in your on you. Tell me when you feel sharp or dull pain.
Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, so you're able to recognize either dull or sharp. Okay, so put your hands, stand up. Put your hands out, straight out, like that, up. Okay, no drifting is noted from the arm. So let's do go back here and walk. Okay, you're gonna walk like one way, like that. Okay. So no cerebellar problems noted. It's okay. So I'm gonna check for your reflexes. Have a seat. So for your reflexes, I'm going to check your biceps for just leave your hand from. You're holding it dead weight. So this is the biceps. Did I do? biceps. So I'm gonna check the triceps here. Okay, so biceps. Okay, so I'm gonna check your brachia radialis. Okay, so let me check your brachia radialis. Patella tendons. No, relax your leg. So, relax your leg. All right. Let me check your salis. Relax your leg. Right. That's that. Let me check for your Babinski. I'm checking for Babinski reflex. Okay, so he has a negative Babinski reflex. Check this. Okay. So there's absence of neurological problems. Okay. So I'm gonna check for alignment and your range of motion. So do your fingers like this. Rapid movement. Okay. Put your hands out, up, down. Do the circular movement like this. Okay. So hold your fist like this. Push against my hand. Okay, push against me. Okay, so bring your hand here, like pronate. Go down, up. So it has full range of motion to upper extremities. So down here, I'm going to check for push against my hand. Okay, push here. Same here. Same there. Okay, push here. Okay. He has 5 of 5 equal strength to bilateral upper and lower extremities. So lie flat for me. I'm going to check for the McMurray. Okay. Hold your heel at 90-degree angle. Okay. Move heel inward. Move it outward. Okay. Move the other one and outward. So let me do this. Bend your knee. Okay. So I'm going to pull. Do you feel any pain?
No.
Okay. I'll do the other knee too. Do you feel pain?
No.
So at this point, I think get down. Let me do the. Sorry, let me do your apprehension test. Yeah. Okay. Yeah, I'm doing your apprehension test. Do you feel any pain or tenderness in your arm?
No.
Okay. So I've done that. So come on, let me do your drop arm test and your Tylenol test. Okay. hold your arm like this. I'm going to hold it. Make it touch each other. I think we should face the camera. Do you feel any tenderness?
No.
Any numbness? Tingling?
No.
Okay. So, left arm. So let me press against your arm for like, open your hand. Do you feel numbness?
No.
I'm taking for your carpal tunnel to see if you have anything like the way you type a lot. You can have problem with it. Okay. So let's do your hip alignment. Okay. Bend down as far as you can go. Down. Okay. Up. Lean backwards. Okay. Forward to the side. The other side. Okay. Okay, I'm just going to check for your spinal cord. The spinal cord appears straight, but it is there's no tenderness noted and no scoliosis noted. So stand with one leg. Okay, that's okay. Stand with the other leg. Okay, that's good. So close your eyes and bring your hand out. Let's see. I'm checking for pronator drift. So your hand is steady enough. That's fine. That's fine. You can stop. So I'm going to check for the hand drop arm test. So I'm going to put your hand like this. So when I leave you, I don't expect it to fall. So I'm going to leave you at one point, but I'm going to see if it falls in the costume. So, okay. So the hand, is not a positive for drop arm test. It's a negative. So his hand strength is equal. So I think at this point we have concluded this exam, and thank you, Chichi, for volunteering, and thank you.